Any questions? Awesome. Any questions about what I've said so far? You can go ahead and post them in the chat, or you can unmute yourself just for a minute so I can make sure we're all clear on who I am. Awesome. So let's talk about sleep. So I want to start with why do we sleep? Because I think it's really important to understand the function of sleep. And occasionally I'll be opening up my computer to share my screen with you, type things on a whiteboard, and I may actually show you some websites if we have some time, okay? Why do we sleep? The first reason we sleep is to consolidate memory. So we believe that sleep is important for consolidating memory. Now, when I say believe, we aren't quite sure. Sleep is kind of the wild, wild west in terms of understanding what happens when we sleep, what the functions really are. But we know three main things. We know that we consolidate memory when we sleep. We know that we organize memory when we sleep. And we know that we DNA repair, which is another way of saying support our immune system. And another way of saying this is fight cancer while we sleep. And I'm going to talk about how we do these things in just a minute. Okay, so it makes sense to everybody that sleep is necessary. In fact, studies show that if you stop someone from sleeping for more than 3 days at a time, their mental status starts to break down and can do so irrevocably, where they're unable to organize thought. That's why it's used as a torture method, which is super unfortunate. And I'm not trying to bring any negativity to the group. I just want to emphasize that we don't really understand why, but we do understand at some point for all living mammals, we need to close our eyes and take a rest. Okay? Good. Any questions about why we sleep before we move forward from there? I have a little bit of an allergy, guys, so you're going to occasionally see me tap my eye or tap my nose. I don't want you to be in the habit of touching your face, especially during this time. So don't copy me. Okay, so if there's no questions about why we sleep, the next thing I want to talk about is why don't we sleep? So it's really important to understand that there's kind of an algorithm that we can look at, or a way of thinking about why we don't sleep. And I'm going to mute you, Susan. Can I mute her? No. Go ahead and do that for me, Shelby. Let's look at why we don't sleep. So one of the main reasons we don't sleep is a major event. So for example, being diagnosed with cancer, of course. Another reason we don't sleep is anxiety and depression. I'm not going to number these because it takes too much time. Dysregulation. So dysregulation could be things like working a night shift, for example. So, or having a habit of staying up really late. When we do that, we reset some of our internal clocks. So it makes it much harder to regulate and go back to a healthy sleep rhythm. And we're going to talk about what that looks like in just a minute. PTSD, you might be surprised to hear that if you had childhood trauma or there's interpersonal violence in your home or in your life, that you have 3 times more likely chance of having insomnia as an adult or having difficulty initiating sleep. So PTSD stands for post-traumatic stress syndrome. And it means that something that in the present is triggering a past trauma, making you more hyper vigilant at night. And again, we'll talk about the clocks that exist in the body that make all of this possible. Exposure to caffeine and other substances that might keep you up at night. Pain is a big one, especially in the cancer community. I don't know if I'm missing something else. Can anybody think about anything else that causes us not to sleep? I see someone in the chat there. Alcohol. Thank you, Dr. Kanda. Alcohol. So we think of alcohol as something that is a depressant. And in fact, alcohol perpetuates insomnia. It doesn't necessarily cause lack of sleep, but it's still a good one to throw on here. Somebody else is saying hormonal changes. Absolutely, that's a good one that I forgot. These are more of things that perpetuate insomnia, but let's put those down since it's not worth it to kind of separate them out yet. So let me move my screen around so I can see you guys at the same time I'm typing. Another one would be obesity. That may seem strange to you guys, but obesity can result in obstructive sleep apnea, which is a fancy way of saying when we sleep and the soft palate hits the back of the throat and blocks the major airways to the lungs, or another way of calling that is snoring. That can interfere with sleep. Obesity also can result in or be related to, not result in, excuse me, be related to heart disease, respiratory diseases. Can anybody think of anything else? These and metabolic issues. So in fact, people with diabetes or thyroid issues do struggle with sleep initiation as well. And again, we'll talk about why in just a moment. Great. I don't know who B and is, but you're doing a wonderful job. She just mentioned, or he just mentioned medications. Absolutely. Medications is a big piece. I didn't catch it, dear. You can just write it in the chat. And you know, a funny one that people don't think about often, anemias, and how often do we see counts being low with chemotherapy? So anemias. Okay. And again, you know, when I was thinking about this talk, I thought, oh, I don't want this to feel dire, because there's nothing that's harder, that makes it harder to going to sleep than worrying about going to sleep, right? So we all think to ourselves, oh my gosh, I need to sleep. It's so important for my care. And I want to take some of the stress out of that for you. It is important, but it's more important in survivorship than it is when you're going through cancer care. So if you're going through cancer care and you are struggling with going to sleep, that can be part of the natural, part of the journey of going through the sleep process and through the cancer process. Is there any way to turn off those alerts, Shelby, or no? Like the noise? Okay, awesome. Thank you. And Beth added other people in the room. That's right. A husband who snores, a kid that kicks you, pets that wake you up in the middle of the night. Good one. Really good. Okay. So anybody want to have anything else to add to this before we talk about why these things can cause sleep dysregulation? No? Okay, good. So why do these things cause sleep dysregulation? Let me close my chat here. So I'm going to erase this board. And don't worry, we'll have a recording. So if you really are a great note taker and a grade A student, you'll be able to come back to it later. And let's talk about the sleep cycle. So what does it look like what does good sleep look like? What is the ideal sleep? And again, you can go ahead and throw your answers into the chat for me. How many hours should we be sleeping a night? Anybody? So it should be anywhere from 7 to 9, ideally. It should be in a dark room. This is what's called sleep hygiene. It should be a cold or a chilled room. There should be some white noise, and I like to accomplish that with an air filter. And there should be something that either filters the air and or has white noise. So for example, if you're not using an air filter, you can use peace lilies. There's an excellent talk on TED TV. Does everybody know what TED TV is? TED TV is a place where little videos, anywhere from 4 to 20 minutes, are posted on exciting developments in technology, science, entertainment. And there's a video on there called How to Grow Fresh Air. And it basically covers the 4 types of plants that you can put in your bedroom or in your house to help you to clean the air. We take a lot of deep breaths when we're sleeping. So it's awesome to be able to, thank you, Sydney, for posting that. The link is posted in the chat. It's awesome to be able to breathe clean air when we're sleeping, right? A room that has good sleep hygiene does not contain electronics. This is often the hardest part for us when we're trying to get people to sleep well, is to help them to turn off their TV. The problem with TV, and we didn't put it on a list, but having a television in the room is one of the known evidence factors as to why people have insomnia. And we can talk about why in just a minute. Any other pieces to what a good sleep hygiene looks like? Oh, I forgot, when we go to bed, can we keep the phone by a bed as an alarm? That's a great question. You can, but it's preferable if you do a couple things, and I'm going to tell you what those are in just a minute, Beth. Before I tell you that, I don't want to lose my train of thought. And guys, I've been seeing patients all day, and I've been up since about 4 this morning because I had to deal with my dad. So I am a little bit exhausted, but so there's things that I may forget and you're going to remind me. Going to bed at 10 p.m. or around 10 p.m. as close as you can get it is also excellent. And actually, as I just mentioned, this may sound really early for most people, but waking up between 5 and 7 a.m. is how your body is kind of wired to work. We're going to talk about what that means, wired to work, in just a minute. So Beth asks, can we keep a phone by the bed as an alarm? Absolutely, Beth. But when we're putting a phone by the bed, if you have an iPhone, I don't know anything about Androids. I only know Apple products. So I will tell you, on an iPhone, you can go to the settings on your iPhone, go to where it says display and brightness, tap the night shift setting, which alters the screen temperature to a warmer color, blocking that blue light. And then the other thing you can do is put your phone on do not disturb and put your phone on airplane mode so that you're not getting any of those cell phone signals near your head while you're sleeping. You can still keep the volume on the side, and you'll be able to hear your alarm when it goes off in the morning. Okay, great question. Any other questions about what good sleep hygiene is? Okay, awesome. And you guys can just throw them on here as we go. Don't be shy. I'm kind of a little bit of an encyclopedia Brown when it comes to cancer and supportive care. So there shouldn't be any questions that I don't know how to answer. And if I don't know the answer, I'm going to kick it to Dr. Konda. She'll know the answer, and she's on with us. Okay? Or Sydney, who's also on with us, and she may know. Can you listen to music with earbuds while sleeping? Yeah, you can. And oftentimes, to help us to initiate sleep, we're going to use a guided visualization. But Linda, I'm going to come back to that point towards the end when we talk about how to correct some of these problems. Okay, good point, or good questions, everybody. Great. So the reason I keep looking the right here is I kind of tried to organize my thoughts just because I knew I was super tired today. So I'm looking at what I want to talk about next, which is I want to talk about how our body manages this internal clock. Like, what does that mean? I'm going to erase this. So we are all hardwired to sleep in a certain way because sleep is so essential to our survival, our actual survival. Um, so what does that mean? It means that when the lights go out and the sun goes down, um, whatever you believe, at some point in our distant past, we didn't live in a place where when the lights went out, we turned the lights on, right? We lived in plains and in caves and in deserts. And when we lived on plains and in caves and in deserts, when the sun went down, the lights went out. When the lights went out, our brains evolved or were created to release a hormone called melatonin. Melatonin, which all of you may have heard of, is a pineal gland hormone. It's made in response to lack of light. So one of the misconceptions people have is that hormone is made to make you sleep, or it's a sleep hormone. That's not true. It is made in response to lack of light. So if I covered my eyes right now, my brain would release melatonin. What's the function of melatonin? So melatonin's job is to assist in DNA repair while we're sleeping. So what does that mean? I'm going to share my screen again. Some of you who are my patients have seen me draw this more specific to you. I'm going to do it in a little bit of a general way. One of the reasons that we get cancer is every single cell in our body is dividing. Each of these cells is making two daughters. Each daughter is making two more daughters, and so on and so forth. Before this cell makes its daughters, it's stopped by border control. Every in your body, all the billions of cells, border control looks at the cell and checks for mistakes. If the cell has made a mistake, it tells the cell to kill itself. That's normal. But if your border control is out smoking a cigarette, goofing off, flirting with the boys or the girls, or what may have you, then this mistake is passed on. That's cancer. So melatonin, we found, upregulates border control. Another way to call border control is DNA repair, because it doesn't just direct the cell to kill itself if it makes a mistake, it tells the cell to repair itself. So the reason why people can get sick, whether it's a cold or a flu, or something more serious like a solid tumor, is because they're not giving their body a long enough time to rest to allow that hormone to do its job to upregulate our DNA repair mechanisms and our border control mechanisms. Any questions about that piece before I move on to the clock? So that's a hormonal piece. We're going to move on to the clock. Any questions about that? Wow. I hope I'm doing a good job and you're not all asleep. um, so, it's so weird because I just see your guys' names and I see everybody on mute. So I feel like I'm laughing at my own jokes and talking to myself, but that's okay. If you guys want to undo your video so I can see your beautiful faces, that would be awesome. Let's talk about the clock that exists in the body and kind of wires all of this. I'm going to share my screen again. And I'm going to clear this. Okay. So every single one of us, in addition to having a border control on each cell, also has a clock. That clock, hi Shelby, thank you, dear. That clock is fixed, so it's hardwired into your body at 3 a.m. This is true of everybody, even if you stay up all night, even if you're a night shift worker, even if you don't sleep very well and you struggle with insomnia. Hi, Robin. This clock exists and is hardwired into your body. So what happens at 3 a.m.? Why is that so important? At 3 a.m., a little alarm will go off, beep, beep, beep. and it sends a little stress signal. Let me find my pen again. It sends a stress signal to the adrenal glands. The adrenal glands are a stress gland. They live on top of the kidneys, and their job is to manage sugar metabolism in the body. So when this clock goes beep, beep, beep at 3 a.m. and it sends this little stress signal to the adrenal gland releases adrenaline. Adrenaline. Another way to call adrenaline is cortisol. You might have heard that term before. So what is adrenaline or cortisol's job? Adrenaline or cortisol's job is to go to the liver. What does it do when it hits the liver? It tells the liver to release sugar. The liver is responsible primarily in the body for sugar storage. So why does it tell the liver to dump sugar into the bloodstream? Anybody? Why do you think? Why at 3 a.m. would you have this little alarm that goes off, beep, 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 and tells your adrenal glands to release adrenaline so that you can dump sugar into the bloodstream? It's okay, it's a hard one. It is so that sugar can go to your heart. These are going to be terrible drawings, folks. Your heart, your brain, your feet, your eyes, and slowly over a 3 to 6 a.m. period, so over a 3-hour period, in a slow drip, wake these organs up. Have you ever wondered why you wake up at all? It's because you have this system hardwired in your body. Otherwise, you would sleep forever. However, this system is set up so that you can slowly wake up over this period. So the ideal in going to bed at 10 is that it gives your system enough time to consolidate memory, organize thoughts, and do DNA repair before this alarm goes off. And then over a 3-hour twilight period, slowly wake you up so that you wake up anywhere between 6 and 7 a.m. rested. This is the ideal system because this is the system you were born with. So this is what exists in your body. You can't change it. What you can do is kind of mess it up. Does that make sense to everybody? Awesome. Thank you for nodding, Robin. I really appreciate that. And I don't see everybody's names, but I do appreciate anybody who's willing to let me see their face, because then I can see you're nodding and I know I'm keeping on track. So I'll just keep my eye on Robin and the beautiful lady below her. Good. Let's talk next about what happens when we dysregulate this. Any questions about this piece? Has anybody found that they often wake up at 3 in the morning like, oh, I have no idea why I'm up? You go to the bathroom, you go pee, and then go back to bed? The reason why is when you're going to bed, your cortisol, your adrenaline is a little too high. So it compounds with this alarm. When the alarm goes off at 3 a.m., instead of going beep, 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 it goes beep, 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 and it wakes you up. And that's why a lot of people wake up between 3 a.m. So the question is, why is my cortisol or my adrenaline high at bedtime? That has to do with stress. Does this make sense, everybody? Awesome. Good. I'm glad to see nodding faces. Okay, and I see a question in the chat here. I always wake up at 3 a.m. Does waking up disrupt this process? No, and you might have typed that right before I explained why you wake up at 3 a.m., but it doesn't disrupt the process. It simply is a reflection of how high your cortisol was before you went to bed. So the alarm, instead of being a soft alarm, is a loud one, Linda. Okay. So when people tell us, when we do a sleep history, we will ask you, what time do you go to bed? When you go to bed, do you fall asleep easily? If you say no, we'll ask you a series of questions about that. We'll ask you, how long do you stay asleep if you stay asleep? We'll ask what times you wake up. We'll ask what time you wake up in the morning. If you're waking up during the night, we'll ask you what you do when you wake up during the night. We'll ask you if you can return back to bed and fall back asleep. And when you wake up in the morning, we ask you if you're rested. And we ask how often after that you're rested. And we ask about your nutrition at the same time. Now, why do we do all of that? Because we're looking for where the stress in your body is peaking. Where is that cortisol peaking? What times of day? Because that tells us whether there's a relationship between your sleep pattern and depression, whether there's a relationship between your sleep pattern and pain, whether there's a relationship between your sleep pattern and how you eat. Does that make sense to everybody? How then can one manage or control their cortisol level? So it doesn't matter if you misspell things, Behand, and again, I don't know your name. I hate to call you Behand, but I'm sure Hand's your last name. It doesn't matter that you make spelling mistakes. I'll still understand what you're trying to say. And I know it's hard to type fast. So just type your questions in regardless. We're going to talk about how to manage all of these pieces in just a minute. I want you to understand the nuts and bolts first, if that's okay with you, so that you can understand why the things I'm going to tell you to do are effective or can be effective. Okay, good. So going back then, folks, to the beginning where we talked about some of the things that make it harder for us to sleep or that interfere with sleep. Remember we mentioned obesity and we mentioned metabolic issues. We mentioned heart disease or hypertension. We mentioned other pieces like that that may not be as obvious to you. The reasons why those pieces, those kinds of things interfere with sleep, if we go back to this drawing, is because metabolic issues cause sugar dysregulation. And at the same time, sleep dysregulation causes sugar dysregulation. So one causes the other. If we're not sleeping, then we tend to have sugar dysregulation because this system is dysregulated and the system is using sugar in order to manage organ function. If we have diabetes and we have very high levels of sugar, we're going to see not only frequently waking up in these times, but we're going to see frequent urination while at nighttime between 2 and 6 a.m. If someone has something like a thyroid disease, then we're going to see changes in their cortisol at the 10 p.m. time. If someone isn't sleeping until 3 a.m., then we're going to see this system set itself forward. So it's even if they're sleeping at 3 a.m., the clock is still going off while they're going to bed. It's happening at the same time. So that sleep is never going to feel restful to that person because they didn't get this time before for the functions of sleep. Making sense? I wake up every 2 hours, Mary says, until I get out of bed in the morning. I've had cortisol checked and it's normal. That's a really great point, Mary. And I don't know if you were here at the beginning, so some of you may have missed some of this, but one of the things that I talked about was PTSD. So for people, and I also talked about anxiety, depression, and mood disorders. So when people have anxiety, depression, post-traumatic stress, and or I know this is super unfortunate, but I don't want anybody to be embarrassed. This is true for me too. If you have childhood trauma or interpersonal violence in your home, either now at the current or previous, those things will also disrupt sleep and even more frequently. So right now we're just talking about waking up at 3 a.m., but someone with hypervigilance is going to wake up almost every hour, every 2 hours, because of the way their neurohormones are responding to the period of restfulness. How do I say that in a basic way? Your mind is very powerful, Mary, so it can override this clock and this normal sleep rhythm or regulation and tell you if you go to sleep, then something bad will happen. It can be fear of death. It can be just internalized trauma, like the body keeps the score from the things you went through in the past. And what happens is your mind tells your body it's not okay to sleep because it's dangerous for you. So there's a lot of ways to regulate that. We're going to talk about simple ways. Some of these questions may be a little too complex for this talk, especially if they're specific to your situation, but don't hesitate to ask them. And our IT person, Q, is going to post some white slips on the chat right now. So you guys can click on those, fill them out with your name, your email. That's the link right there. It says HIPAA Jot Forum. Go ahead and write your name and your email. We do not sell or do anything with your information, but you can put your questions on there and we'll email you and reach out to you with support questions and answers. Okay. So before we talk about what to do about all of this, because I know you're really eager to hear, let's look at a couple of things. I wanted to show you actually just one thing. And I tried to pull it up already so I didn't waste time. Here it is. I want to show you the NCCN guidelines. So I think one of the things that people don't know about cancer care is it's pretty formulaic. It is not, there isn't a doctor who's making individual or creative decisions about each individual and how they should be treated. Instead, there is a group of hospitals and clinics that make these decisions. There's 27 in this country about how to treat each cancer. And then the government rubber stamps those treatment protocols, and those become the protocols for every patient. Now, that's good and bad. We can have a long discussion about why that doesn't work or does work. But what I do want to point out to you is despite the fact that they lay out these guidelines, they're not always followed in a comprehensive way. So this is the NCCN. The NCCN, which you can create a profile on for free, is the National Comprehensive Cancer Network. It is where all of the guidelines are posted for physicians who are making decisions about your care, sort of an algorithm for how to treat you. You can create a patient profile and download patient information. On here, you're going to see under these guidelines, it says supportive care. This is what our clinic does, is supportive care. And if I scroll over, I'm going to make this a little bit bigger in just a moment. If I scroll over to supportive care, you'll see all kinds of supportive care that your doctor may or may not talk to you about. Distress management is not often talked about. Cancer-related fatigue. But I really want to focus here on survivorship, just because I think it's really important to understand that these guidelines are really well laid out. And I'm just going to put in my password because I have access to the clinical guidelines. These guidelines are really well laid out for what we should be doing for sleep and that we should be treating it. So not sleeping is a known problem in cancer care. And what's frustrating, at least for us in our clinic, is that all of these pieces should be part of a comprehensive cancer model and are not. So what our job is to fill in the blanks. And I see, oh, thank you so much. So one of my colleagues just let me know that I have some patient data up and it is viewable, which is not good. Let me just delete that bottom line. Thank you so much for that, Dr. Kanda. And I'm going to go back to sharing my screen with you guys. That's too bad. Okay. Hence being tired. And with Zoom, you don't always know what everybody's seeing. Okay, so back to this list. So as I was saying, a truly comprehensive cancer a cancer model should include all of these pieces, including information about sleep. In other words, if here's my beautiful patient, when they're diagnosed with cancer, they should, of course, be seeing a medical oncologist because the medical oncologist is the person who gives us chemotherapy. They should, of course, be seeing a radiation oncologist because the radiation oncologist gives us radiation. They should, of course, be seeing a surgical oncologist because the surgical oncologist gives us surgery. And in the comprehensive system, there may even be a nurse navigator or a social worker. But this wheel doesn't go all the way around. It just kind of tips on its side, which doesn't move the patient forward. They should also be seeing someone like myself, a FABNO, who does supportive care and addresses all of these pieces, right? They should also have specialized social workers for financial toxicity, employment issues, logistics, paperwork, insurance coverage. They should be seeing a nutrition oncologist, which is what Dr. Konda is. So someone who specializes in how to use food in order to manage and treat all of these problems. They should be seeing someone who's a mental health specialist. I'm drawing with one finger here, guys. They should be seeing someone who's a mental health specialist in cancer care and helps to manage anxiety and depression. And they should be seeing someone who can help with physical ailments, so physical therapy, massage, Reiki, things like that. All of those pieces are really essential in cancer care and are not recognized despite the fact that these are part of the NCCN guidelines. And you'll see that jot form again from our practice manager, just because if you have any questions, we want to get them answered. We also want to know everybody who came to the talk, who you are, and just say hi to you. Let's click on that. So I just clicked on the sleep guidelines. And you'll see it actually gives you an algorithm for how to screen, which we do. It tells you what happens when you screen them. If there's no concerns, then you follow this arrow this way. If there are concerns, then you follow the arrow this way. So literally the guidelines are super explicit and tell us what to screen for. And as we talked about in the beginning, we talked about a lot of these, right? We almost got everything on here. Even shift work is on here. Night shift workers have a 40% higher risk of cancers of solid tumors like breast, colorectal, etc. Now, many of us on this program may not be night shift workers, but many of us stay up all night, which is in essence the same thing. Does that make sense to everybody? So this algorithm continues to move forward, and we don't need to go through this together because it's irrelevant. We've gone through it in much better detail already. I only wanted to point out to you guys that good health is a human right. It's your right, and managing your sleep is a part of what your doctor should be doing. Okay, good. Let's talk about how to manage all this now. Any questions about that piece? Nope. Okay, awesome. So I'm going to erase this. So knowing just the little pieces that we know so far, what can we do to optimize our sleep? I see the question there. Could it be that's caused by a lot of stress that occurred right before the diagnosis? Absolutely, Beth. In fact, a lot of stress right before your diagnosis can also not just change the way you sleep, but can increase inflammation in your system. And that inflammation can increase the rate of cell growth and can accelerate or drive cancer cell growth. So sometimes you'll see you have a major event in your life, and then a year or two later, you're diagnosed with cancer. So oftentimes you'll see that connection. Okay. Sugar itself is pro-inflammatory. Now we can't get away from sugar because we store it in our body. It's used for everything. It's the only fuel your brain can use. But sugar is pro-inflammatory. It irritates the blood vessel wall. And when it irritates the blood vessel wall, it causes inflammation. That inflammation makes the blood vessel wall, instead of being nice and slick, it makes it sticky. So fat, which we're eating, gets stuck on that, like gum on the bottom of a shoe. Calcium comes along and makes a plaque here. And now we have a narrower blood vessel. Why does that matter? Because then the pumping upstream pumps harder against that blood vessel. What's that called? Hypertension. What is it called when we start going from a 4-lane freeway to a 2-lane freeway? It's called atherosclerosis, right? So these conditions are all connected to each other. Everything weaves together. You cannot treat one without treating another. That's the whole point of a holistic model. So it's impossible to piece out sleep from how you eat. It's impossible to piece out how you eat from heart health. It's impossible to piece out heart health from mood disorders. It's all connected. And if we had all night, which we don't because we're going to go to sleep, I would talk about all of those things with you. A good idea is to send Shelby a list of topics. I'm happy to talk on those, or Dr. Konda can, and explain all of your questions in detail, or answer all of your questions in detail. So let's talk about what to do. So here are some tips to optimize sleep hygiene. So at first glance, these are going to seem very simple, but they're actually profound. So you need to sleep in a dark room. So what does that mean? It's very important to get curtains that block light. So you may not realize it, but you are exposed to a ton of light at night. It's street lamps, it's even little dots on an alarm clock, it's people's cars going by. Any source of light at all will minimize the amount of melatonin that your brain is making, and interferes with your ability to do DNA repair, upregulate your border control, and therefore slow cancer cell growth. Okay? 2, it's really important that that room is chill. And I know that that can be hard for people who like to be warm. So you kind of have to get there in pieces. Do all of this slowly. Don't try to do everything at once. Sometimes that may mean keeping the windows open or a window cracked during the winter. And sometimes that means having a fan on in the summer. Summers are hard because I don't love air conditioning in a bedroom, just because it's a lot of hydrofluorocarbons, and I don't know if people's air filters are super clean, but definitely keep it as cool as possible. Use maybe just a sheet and a fan. You want to have a protein snack before bed. Now, some of you are doing intermittent fasting. Some of you are like, oh, Oprah told me not to eat after 8. I don't care. A protein snack right before bed, and I don't mean like as you're getting into the bed, but I'm saying maybe an hour. Dr. Konda, would you say 45 minutes to an hour? I'm not sure. She'll chat with me in just a moment. 45 minutes to an hour before bed will help to stabilize that blood sugar and mute that cortisol alarm that's going off at 3 a.m. That's why our parents gave us a protein snack before bed. So some of the things that are good for a protein snack might be whole wheat toast or a gluten-free toast with almond butter. Some of the things that might be helpful are oatmeal with cashew butter in it. Turkey, cheese, and crackers if you're eating meat. handful of nuts. Okay. Why? Because having a protein snack, and in my generation, our parents used to do it by giving us warm milk, if you guys remember that, right? Having a protein snack before bed modulates that alarm and lowers the volume a bit. Okay. Making sure when you go to bed that you're listening to a guided visualization if you have a running mind. So a couple of things that can happen with a running mind, or that we can do for a running mind: guided visualization. There's some on healthjourneys.com, or if you don't want to pay the nominal fee that's associated with those, you can go to YouTube and look up guided visualizations for sleep. These can be very helpful for someone with a running mind where we're worrying all the time, right? Other things we can do for a running mind is something called a mind dump. So it's journaling, sometimes with your non-dominant hand. So for me, that would be my left hand. Writing stream of consciousness. So by journaling, I don't mean, oh, such and such about my kids, my wife, my husband. I'm saying stream of consciousness, so that it's almost like whatever the ribbon tape that's running through your mind is, you're actually expressing it on a piece of paper without even thinking about the words. There's a long-term study that was done through Harvard, an over 30-year study that showed that people who do a mind dump right before bed over a period of 30 years have significantly lower levels of depression, anxiety, and higher levels of what we call happiness. Somebody is asking me, is lack of sleep linked to a history of inflammatory conditions such as migraines or rheumatoid arthritis? Absolutely. Beth, that's a complicated question, too complicated for an hour-long talk, but absolutely. Anything that increases inflammation in the body will interfere with your ability to manage sleep, and anything that interferes with your ability to manage sleep will increase inflammation in the body. Inflammation upregulates cancer cell growth, or cell growth in general. A weak border control then has a hard time catching cells that are growing too fast. So that accelerates cancer cell growth. Okay. Keep throwing your questions on there, but I'm going to open this up for a Q&A in just a minute. Right before bed, a patient told me this today, so I'm just going to throw this on there. Lying on the floor with your feet up on the wall so that the blood is running towards your core, and having your arms outstretched, kind of like a T shape or a cross, and doing 8 deep breaths. And all of your prayers or your worrying at that time. So 8 deep breaths would be in through your nose, out through your mouth, in through your nose, out through your mouth. And you're going to do that to the count of 4. So count of 4, in through your nose, out through your mouth. So some people are telling me that they have some internet connectivity issues. If you're having those, let me know. They're logging off and trying to log back in through your nose, out through your mouth. Okay. To optimize sleep hygiene, we want to try to go to bed before 11 p.m. Set small goals. If you're going to bed at 2 a.m. right now, you're not going to be able to go to bed at 10 p.m., excuse me. So if you're going to bed at 2 a.m., set your goals for 1:45 for a week, and then try for 1:30 for a week. Set small goals to get yourself to 10 p.m. If you're going to go to sleep by 10 or 11 p.m., you need to start a sleep wind down routine. So again, this sounds really simple, but if we are actually doing all of these things, we can see profound changes. A wind down routine would be low lights in your house, turning off all electronics, maybe doing an Epsom salt bath if you like baths, Or you can do lavender essential oil in that bath, or you can smell it. Having a routine, just like you did with your kids. This can be the time that you have that protein snack. Okay? It alerts your body to the fact that you're going to sleep. There's some supplements that can be really helpful here. And the best place to get these, because I can control for quality, source, and contamination, is Be Well with AIM. The password on there is AIM. That allows you to access Emerson Ecologics, which is the nation's distributor for clean, safe pharmaceutical grade supplements. So some supplements you can take, 1 to 5 milligrams of melatonin will actually cue your brain that it's time to sleep. Now, it doesn't mean it's going to help initiate sleep. So oftentimes people take it and they're like, I didn't sleep. It's a cue. So what you're doing is trying to gently reset that clock by introducing a tiny little bit of melatonin to urge your brain's normal production. Okay. 20 to 40 milligrams of melatonin does not initiate sleep. It doesn't interfere with sleep initiation, but it does not initiate sleep. That is a cancer therapeutic, and we can talk about that at another time. Sleep REM from Priority One is a combination of Indian and Chinese herbs and hops that can be very helpful for regulating sleep. And theanine, which is an adaptogen. Adaptogens are natural substances that help your body adapt to the way that adrenaline or cortisol is being regulated or used in your body. You must avoid caffeine or other substances. And if you are taking substances like steroids, medications, for example, that do interfere with sleep, doing all of these things will help. Don't stay in bed. Don't lie around in kind of a daze if you can't sleep for more than an hour. Get up and do something boring and try again. You can take anywhere from 100 to 600 milligrams of theanine. So start with a low dose and work your way up. Now, we have excellent psychiatrists that we work with that are super empathetic, great listeners that your insurance will cover, that will sit down over Zoom with you and help you with certain medications to help you to initiate sleep and maintain sleep. And they're often screening for PTSD, childhood issues. So helping you connect with a counselor, which we do as well, to work through some of those issues, some of that trauma, which also can come up in cancer care. For example, if when we were a child, we were, God forbid, sexually abused, and now we have, let's say, a breast cancer, everyone's poking and prodding. We're constantly having to take our shirt off around people we don't know. That can trigger old injuries, for example. Those old injuries get recorded in how your body manages stress, right? So the things that you knew, that you know, and you already do to manage stress during the day are really important. Eating at specific intervals during the day. So eating protein and eating every 3 hours if you can. Some of you can't, because I know some of you have specific diseases or specific conditions that you're working with. I'm saying in general, for the average person, eating every 3 hours and eating a little bit of protein with each small meal helps to regulate your blood sugar. And of course, seeing us or another supportive care integrative oncologist to work through the underlying problems, the health problems that can cause sleep disruption. I'm going to open it up right now. I'm hoping I didn't miss anything, and I'm sure you guys are going to tell me if I did. I'm going to open it up right now for questions, and I think the best way to do it is the chat, but if you can't type, then go ahead and just unmute yourself, and we can just see how it goes. And if nobody talks, then I'll probably give it maybe a couple more minutes, because I think, Shelby, was this from 6 to 7:30 or 6 to 7?
It was from 6 to 7, but I mean, we don't want to cut people off if they have important questions to answer. So I'll hang on here with you guys too.
Awesome. Okay. So we're going to keep it open for about 5 more minutes. I'll be silent for a second. And if no one talks for a couple minutes, then I will just start rambling until 7:15. Okay, great. Mary had a question. How much total protein per day? So Mary, 30 grams is kind of the minimum, which is about 3 tablespoons. It's a small amount, so about the size of your fist. But it's not about how much. I don't want you to get technical with it. I want you to get used to the idea of something kind of radical yet basic, which is your body is actually designed to work beautifully. It has a rhythm to it. It has a soul to it. It has a natural flow to it, so to speak. And I want you to start listening to that. You know, when do I feel tired during the day? Do I reach for something sweet or do I reach for something with protein? Can I have something with protein when I crave something sweet? Do I nap during the day? How long do I nap for? Maybe if I cut that back a bit, will that make a difference? For example, if you're craving sweets, one of the things you can do is take something sweet like an organic brownie mix and put in a can of beets, a can of black beans, some protein powder, bake it, put it in the cut it into squares, put it in the freezer, and have a little tiny fudgy piece. When you need a protein snack, you'll get that sugar hit, but it'll also help to stabilize your protein. So it's not really about how much, it's about listening to yourself. Make sense, Mary? Hi, Helen. Helen wants to know, how about a sleep mask versus room darkening shades? That's what I use, Helen, but I also use room darkening shades because I'm super particular about taking my own advice. So I actually do and take everything that I give you guys, or I try everything that I ask you to do because it's really important to me to walk the walk, but also to experience what you experience. I use both. But if you cannot use room darkening shades, a sleep mask is fine. I like it to be an organic silk one only because I don't want you to be absorbing a lot of dyes or other chemicals when you're sleeping. Does it matter if it's animal or plant protein? It doesn't matter for the purpose of this talk, Mary, because right now we're just talking about sleep, right? But remember how I said it all fits together. So if we're talking about how to fight cancer, then yes, in survivorship in this, for the sake of this talk, means after we finish treatment, it does matter. And we do want to aim for plant protein. But if we're talking about during cancer care, where sleep is an issue, then no, it doesn't matter. And in essence, it won't actually accelerate cancer growth to have animal protein during cancer care. It's more important actually to keep your weight up. If you've got a little bit of weight on you, you're going to tolerate treatment better. Great questions, guys. Given that some medications can disrupt sleep, is there guidance regarding time of day for taking particular medications that you provide your patients once you understand the meds they are required to consume? Becky, great question. So I don't know if I've seen you as a patient, Becky, because I don't know if Becky's a nickname. And we have a lot of Beckys. However, we do all of it. So we spend anywhere from 60 to 90 minutes in a first office visit. We will look at everything from what brings you joy to whether you feel safe in your home, to what your fears are. So your medications are absolutely taken into consideration. And if we feel that they're going to interfere with anything that we're doing, and you're not sleeping or not sleeping the way we need you to be, then yes, we will adjust when you take them. Good question. That's true also about supplements, Becky. So everything is individual. The problem with cancer care is not just that it's hard to go through without supportive care like us. It's also that it's one size fit all, and nobody works that way, right? We're all snowflakes. We may all have this clock hardwired, but how we interact in the world is very different. So we adjust based on the patient. For example, if a patient urinates very frequently at night, they can't take nighttime supplements because they don't want to drink the hour before bed, we might move those up to dinner. Any other questions? Good question, Becky. So while we're waiting for Becky, for anybody to come up with any questions, Shelby, I'm just going to hold it till 7:15 and see if there's oh, Robin has her hand up. Robin, go ahead and just unmute yourself.
Hi, Dr. Roy. Just a temporary situation, but any thoughts about first-time moms with a newborn infant who's being breastfed every 2 hours around the clock at night? They become exhausted, hard to nap during the day. I hear people laughing, yeah, we're dealing with that with my new grandbaby.
Well, I just muted. I'm muting you, Robin, because you've got a lot of reverb on your sound. So first of all, congratulations on the grandbaby. And oh my goodness, are you asking for Dr. March? So her baby was born about a week ago. So if you do have if you're a breastfeeding mom and you're feeding your baby every 2 hours, is there anything you can do about maintaining sleep? No, you have to breastfeed your baby every 2 hours and you have to be alert to do that. The only thing you can do with a new baby is catch sleep when they sleep. So the difference is that in terms of how you sleep is you sleep when they're sleeping. That can be really hard if you don't have a partner. That can be really hard if you're returning to work right away, but it is the ideal that mom is with baby. And when baby goes to sleep, mommy goes to sleep. And it's the only way to get any sleep. But usually parents for the first couple of years are in a daze and super confused. And that's a really good question for Dr. Konda. So if you want your niece or your daughter to talk to her about how to manage sleep, she is going to struggle, as you see new moms do, with hormonal dysregulation, a little bit of abdominal weight gain, changes in their metabolic function, and even depression, because sleep is a part of that. Being sleep deprived is a huge problem when we have a new child. I'll show you there is a type of, I meant to mention this as well. This is not appropriate for Robin's question, but one of the evidence-based ways to manage sleep is CBT, cognitive behavioral therapy for insomnia. It's called CBTI. Frankly, your primary care doctor is supposed to know how to do this and should be able to do it in 6 to 8 sessions with you. And it's really helping you to think through or restructure thoughts before you go to bed, like playing out scenarios. A lot of us, right before we go to bed, we're thinking, what ifs? What if this happens? What if that happens? And playing those scenarios out and experiencing them during the daylight hours. What are the worst case scenarios? Planning for them helps us to stop doing that at bedtime. Another thing people do right before they go to bed is they do their to-do list. So learning how to manage the stimuli to do things, to always be organizing things. The biggest problem for us when we're worrying before bed is control. We all feel like if we had more control over today, over tomorrow, over yesterday, then we would have more peace. When the inverse is true, we actually have no control over yesterday, today, or tomorrow. And cancer kind of exacerbates that feeling of lack of control, which is one of the reasons why worry becomes so extreme when we're going to sleep. But if we can come to a place, whether it's with CBTI, whether it's with counseling, whether it's with prayer, spiritual reflection, whether it's with guided visualization, where we understand that control is our enemy and not our friend, we can restructure some of those thoughts before we go to bed. Sorry, Robin, I jumped right off your question because I'm a cancer doctor, and that's not an awesome question for me, but I hope it helped you a little bit. Any other questions before we end for tonight? No? Okay. So this jot form that you're going to see in the chat there, I do want all, unless you're already my patient, because then I already have your name and your email. I want those of you who are not my patient, please, to click on that for me and put in your name and your email so we can keep in touch with you. We do a lot of free speaking. We're doing a talk next week for Beaumont on CBD and medical marijuana. We're doing one on nutrition and cancer later in the month. We're doing an event at an opening at Myers on herbal teas for nausea, sleep, anxiety, stress. And then I think we're speaking again, Shelby, in October on debunking nutrition myths around cancer. All of the speaking that we do and all the education we do is free to you, but we want to be able to make sure we're reaching everybody. So giving us your name and your email allows us to let you know when we're speaking and where. Okay? I hope this was useful for everybody. I always say this at the end, but it's always an honor and a pleasure to talk to you. You guys make my life worth living, and you bring my life meaning, and you're all warriors. You will get through this. Definitely call or email if you have any questions, you want to see us, you have any thoughts, concerns about how we can do better to manage side effects, to prevent long-term damage from chemotherapy and radiation, and to optimize survivorship and slow progression. It doesn't matter where you are in your cancer journey. There's so much you can do to empower yourself so you don't continue to suffer. And Susan, I see your email there. I'm going to go ahead and put that down, but you can just click on that form so that you don't, not everybody has that. And I don't know your last name, dear. So if you just click on that form, I'll be able to say hi to you. Thank you, Linda. I really appreciate that. I hope everybody got this down because I'm going to take this off so Shelby can say goodbye to everybody. Shelby, you want to take it from here?
Sure. First and foremost, thank you so much, Dr. Roy, for coming and speaking with us. We always love having you here. Our members love having you here. So we're just very appreciative. And thank you to our members who have come. I hope you guys got a lot out of this tonight. And we look forward to seeing you at our lectures in the future.
Awesome. Yep. Charles ended it the right way. Everybody sleep well and get our max hours tonight.
Absolutely. Take care, everybody.
Okay. Goodbye.
Thank you.